good evening. Thank you so much for tuning in tonight to this very important discussion as it relates to elderly care. And we are privileged to come to you again from the campus of the Mount Zion Baptist Church in partnership with Western Michigan University, Homer Stryker, MD, School of Medicine, and partnering with this very crucial, critical, and important conversation. Could you please help us and spread the word? And there's some very easy ways to do that on the platform that you're on. Click share. Share this link on your page. Just click share. And even tag a couple of people in it to let them know that we are on tonight for this important conversation. If you've done that, just click in the chat, hey, I've shared it. Put that in the chat, I've shared it, and we'll see our numbers increase tonight. So take a moment and do that, share it, and thank you for being on time and punctual. There's a lot to be said about people who are punctual and on time, and that's you. So thank you for coming on tonight.
A lot has been done in preparation for tonight. This preparation is done with you in mind. We want our community to have all the information that you need to actually navigate this life. 3 John 2 in Scripture tells us that I wish above all things that you prosper and be in good health, even as your soul prospers. And so that's the basics that we really want our community healthy. We want you navigating this life with ease. Let's pray. God, we thank you now for this time of sharing. We thank you for the preparation that's going on today. We thank you for the study. We thank you for the experience that you brought in this room and those individuals that have resources and knowledge that can help our community better. So now bless our time of sharing tonight. Our prayer is that information will be given, questions will be answered, and decisions can be made to the betterment of those that are in our community. In your name, Jesus, we pray, amen. If you have a mother, if you have a father, if you have a grandmother, grandfather, if you have a great-grandfather, if you know somebody that's older than you, then this discussion is for you. And so once again, as you've shared already, make sure you share. This is a powerful discussion tonight. It's talking about elderly care. How do we care for our elderly? And Scripture lifts up that you tell a whole lot about our community, from a community about how they care for their children and their elderly. And so we're here tonight. This discussion is for elderly care. How do we take care of those individuals that have served in our community, have raised children and grandchildren, and now to the point where they need care? How do we do that? And our discussion is geared toward doing that tonight.
Yes, sir. And we have a panel of experts who are here to engage in conversation with us, and individuals with experience who can give us things to think about, things to do. And I'll say this as we start out: if you have any questions whatsoever, please put those in the chat. And if you are definitely experiencing this, walking with someone through this, even put those questions that we should be asking in the chat to help this discussion. As you said, Pastor Moore, this is a community conversation, and we get the bulk out of tonight by answering questions that are on your mind, and that's how we know that we are actually hitting the target. So I mentioned that we have individuals who are here who have expertise in these areas. So I'm going to start all the way to my left. If you don't mind, please introduce yourself to the world here.
Hello, world. My name is Daniel Bronner. I'm a physician, and I'm a geriatrician. I've been doing this since the mid-'80s. That involves taking care of older people, sort of like a pediatrician, but a geriatrician is someone who takes care of older patients.
Awesome. Thank you so much. Click welcome in the chat. When I click it, you got to type it. Type welcome in the chat. Thank you so much for coming, sir. To my left.
Hi, I am Dr. Stephanie Elwood. I'm a family physician, and I work for Western Michigan's medical school. So I've been caring for newborns to our respected elderly, and so, yeah.
Thank you so much for coming. Welcome, welcome. All the way to my right. Would you please introduce yourself to us?
Sure. Hi, my name is Patty Stratton, and I'm a master's level social worker. And I've been working with the Area Agency on Aging 3A in Kalamazoo for almost 20 years, and I work for Kalamazoo County.
Thank you so much. Welcome, welcome. All right. And returning once again to my left or right. Yeah, you're my right.
Hi, good evening. My name is Dr. Heather Renter. I'm a gerontologist. So like Dr. Bronner, I study aging from a theoretical perspective and have really spent my career working with older adults in terms of how to live well through chronic disease and the complexities of life in the last years and decades of our life.
Thank you. Thank you so much for being here. And then all the way to my right next to Pastor Moore.
Good evening, everyone. My name is Cheryl Wright, and I am actually in the process of taking care of elderly parents. So I'm here to give the perspective from the community as someone who is actually experiencing it right now.
Awesome. Seems like we got a rich, all we need now is those from our community, from those audience, those of you that are tuning in to chime in. And I see our numbers, Reverend Chris, are climbing.
Yes.
And so we really want to give you opportunity to call someone, and particularly, you know, when someone that's caring for elderly, someone that's elderly that have children, grandchildren that are dealing with a situation of loneliness. You're talking about depression, healthcare problems, ageism, financial insecurity, difficulty with everyday, with mobility, all the things that comes with aging. And so we're here tonight to share. And this is what we pledge. If we don't have the answers, we will get them and share them because our community, and we thank God for WMed for their partnership, willingness to find answers and give information that's helping our community. And the reason for this platform is so we can actually hear from those individuals in our community, not just to give you information, but provide a platform where you can ask the questions that are meaningful and beneficial to you, those questions that you know that will help you navigate your situations better. So we're here tonight to be an aid and a resource and source for our community. So we're glad that you're joining. Panel, we thank you for coming. And Cheryl, thank you for being here. I always like to have the community perspective here, someone to really put a face on, like, we're dealing with this and we need some answers. So let's just start off talking about elderly health care. Let's jump into discussion. And let me just start off by asking this question here. What are some of the difficulties that you have experienced that individuals are struggling with and dealing with as it relates to becoming elderly and dealing with elderly populations? And I'll start with Dr. Bronner. Yes.
All right. Well, problems of getting older, and especially in terms of our medical system. So I think one of the big problems is actually finding doctors who will actually take care of you over time, primary care doctors. I think it's become a difficult situation to find a doctor who really knows you. And I think part of the problem today in medicine is that lots of care is between strangers. And I think especially for older people who have a long and rich medical history that's often not known by the people taking care of them, this can be a huge problem. So getting older is, what happens is you sort of accumulate problems. They don't diminish. So the things you have, you continue to have, and sometimes people get better, but usually there are several chronic conditions that are older people tend to accumulate. Hypertension is one of them, which can lead to all sorts of problems, diabetes. There's also problems sometimes with cognition and cognitive changes that happen as people get older, which can be very hard to sort of untangle and figure out. And the other problem, I would just say the last problem I'll mention is something that I've become really interested in the last several years, is the whole notion of polypharmacy. And that's just older people especially being on just way too many drugs, in part because they see so many different doctors and everybody sort of likes to start their own drug. And so that's something that I've been dealing with a lot since I got to Kalamazoo.
Cheryl, does any of that Can you speak to that?
Yes, and if I could give just a little
Sure.
background too. So for me, my mom went into the hospital last year, and so overnight I became a caregiver. And we went from her being at home to going to a nursing facility for rehabilitation because they said that she couldn't be, she needed 24-hour care. And after that 2-week period, we were given 48 hours to take her home. And with that, I was given a photocopy of a sticky note with resources and names of places like the Area Agency on Aging and things like that. I didn't have a clue as to what any of that meant. So learning about what all the medications were, did she need to be on everything? They changed things from when she was home to when she went to the hospital to when she went to the nursing facility. And then when we were sent home, like I said, it was just kind of like, happy researching and let us know what you come up with so we know who to send all of her paperwork to. And yeah, that's what I said too. And I was just out here floundering. So for me, that does resonate because now I'm on top of the medication at this point, and we have had a lot of learning and reconciling with that. But the biggest thing that would have been helpful, that was the biggest problem, was knowing what the resources are, but not just what they are, but what does it mean? I said to someone early on, and I said that to her, and she said, well, no one can tell you who to choose or who to work with. I said, but I don't even know what it means. So if someone could even say to me, the Area Agency on Aging is the umbrella for everything here in Kalamazoo, and they can help connect you with different resources within the community, because I was just calling everybody and asking all the same questions, and she was saying, well, why did you call this person and this person? They do the same thing. And that was the biggest problem, was I didn't know.
So, Dr. Renter, can you help us with that?
Sure. So as everyone has pointed out, it can be quite the maze and a little overwhelming, I think, when older adults, either themselves or their family members, and sometimes, like in your case, a family member might be coming in on the other side of an event where now we have a crisis, now we have a family situation, rather than just an acute individual situation. So an adult parent, a loved one, and the adult children are sometimes on a different page and different ideas and different hopes and expectations of what happens next and how do we get there. So those resources are really important, and there are many of them in the community, and there is a very real challenge of navigating those and not being overwhelmed. So we offer a support group in our facility, and one of the things that I hear and respond to every time we have a support group is someone will be talking about something, and I'll say, oh, you should talk to Patty Stratton at the Area Agency on Aging, or you should connect with this resource or that resource. And they'll say, no, they'll stop me. And it's for those same reasons that you mentioned, because just sending them to the resources doesn't necessarily help them identify which ones will be useful, when, and how. So learning how to self-advocate and to be an advocate for the person that you're caring for, and that could be yourself as you grow older, I think is an important step and an important tool that we can all learn to do, to be able to recognize what we need and how do we ask for more information, and how do we not just ask for the information, but ask for support in navigating it.
So, Patricia, help us then, because, and Cheryl said something that's very interesting. So you're thrust in it. I'm not expecting it, but all of a sudden my mom, my dad have these situations, and it's here now. Where do you start?
Yeah, that's very, very challenging, because you're in a crisis situation and you're given this list, right?
Right.
Call these places, and you're
Right.
expected to know what to do. The great thing about the Area Agency on Aging is you can call, we do have walk-in hours. We have these databases, and we have lists of assisted livings, nursing homes, hearing aid places. We have all kinds of just different lists of resources, and we can walk you through that, and we can send them to you, and we can kind of make sense of what you're navigating at the time. And that's really important, because we're a non-biased agency that can really help you manage, again, what spot you're in at that time. It may change later, and that's a journey that you're going to go through as a caregiver. And we are really fortunate in Kalamazoo County. There is a lot of resources out there, but again, you don't know what they are
Right.
until you know what they are. And we have those resources available to us, and that's what we do as an agency, is try to give those out. But again, you can have 10 lists in front of you. That's not going to help you if you're overwhelmed. So let's break it down and figure out what you need right now. And that's the kind of thing we can help caregivers with. And so that's what we do in the moment with caregivers. And we try to work with discharge planners and other agencies like the Heritage where Heather works, and all the agencies around. We try to work in conjunction with them to try to help people be successful in their journey. But yeah, and the goal is try to keep people independent for as long as possible, right? And when they have those hiccups where they go into the hospital or they go into nursing homes, the goal is to get them back to their home. And let's figure out what services we can bring into the home to keep them independent. And we do have programs that can help service them into the homes, because that's the goal, is to keep them in the homes.
So then is it,
Pastor Moore, can I say this? But right before you ask your question,
sure.
For some reason, the Facebook platform had a technical difficulty. So we need those of you who are on YouTube to please share and let everybody know, hey, we are still live on YouTube, and our tech team is working on the Facebook platform to get it back up and running. However, this is still a very important conversation, and just because we had a technical difficulty don't mean that this information is any less relevant. So please do that and let us know that you're helping us by sharing, and just put that in the chat. Thank you, bro.
Awesome. Thank you.
So can I share our Kalamazoo County website and our information and referral phone number for everyone, so they can write that down if they need to?
Sure.
Okay, so you can go to www.calcounty.com/AAA, and then you can look up all of our adult services and how to connect with our information and referral. Or you can call 269-373-5173.
And we'll circle back toward the end and make sure we get those numbers again.
Okay.
But my question is,
Now we back live on
We're back.
Facebook. Yeah, it's back up. So please share. Say we back.
Okay.
All right.
All right. We're back live.
Yeah, we're
back live. So then, now let's, because here's the challenge. Here's the challenge in a lot of our community. So you're talking about, you go to a website, that's a challenge for some individuals. And so what's helpful in my mindset now is, so you're thrust in a situation, as is Cheryl, who do we go to? Is it area?
Agency on Aging?
Is that a good place to start?
Yes, it's a good place to start.
And we can talk to a person?
You can talk to a person.
Okay.
And if you want, you can come in and talk to a person.
Okay, all right. Okay, so that's a good start for a lot of individuals I know in this community, because oftentimes what we do, we have systems, and we think the system solved the problem. But when the system is an interference to communication, because I don't know how to navigate the system. And so what I like about this platform, we get real information, and we can talk to people and then learn a system, but not learn a system and talk to people. Does that make sense? Mm-hmm. Because oftentimes people that don't know anything about a system has to learn a system before I talk to people. And that becomes a deterrent now, and I get frustrated, and then folk are not getting the care they normally would get because I don't know the system. Even though, as you said, and we said it a lot in Kalamazoo, our county, this place is rich in resources, but as you've said very clearly and aptly, that we don't know where they are. I mean, I'm hungry, there's bread over there, but I don't know what's over there, so I'm starving.
Right.
Yes.
And if you go to one, they might not know about the rest.
Yes.
But our agency has a list of everything out there. So that's why we're a good place to start. Yeah. And we're non-biased. We're not going to say, go to this one, because we don't gain anything from telling you what's out there.
So what if your loved one doesn't live in the area? So you have individuals whose parents live outside of Kalamazoo, even other states. What do you do?
There's an area agency on aging in every county, in every state in the country.
Oh, wow. Okay. You shaking your head. You agree? I thought I had a follow-up question, but I didn't. So, I was trying to stall for a moment. But I think that that's a very good thing to know. I didn't know that every county has now, does the area agencies, are they very similar to Kalamazoo's with
Yep.
all the resources?
A lot of them have some different resources, but most of the resources are the same.
Okay.
And so, like, for example, my client moved to Florida, so I called down to that county and had his services transferred all the way down to Florida.
Gotcha.
And some of them are called Council on Aging, but it's the same thing.
Okay.
Some of them are called something different, but it's still an area agency on aging.
Gotcha. So, Pastor Moore, you've had two parents.
I did have two parents.
Yeah. Who, experience this. You're in Michigan. Your siblings, many of them are in Philadelphia. Another sibling here. Two siblings outside of the county of Scriven County, hours away. So what did you do to take care of your parents who are aging hours away from anybody?
Well, fortunately with us, it was 8 of us, and we actually took turns going down at a week at a time to ensure that we were there to help walk them through these situations. And once again, it was a learning process. You had to, and that's why I talk about learning, going and talking to individuals, because it really helps when the person is available, because it's easy to put you on hold when you call. It's easy to have music playing that you don't want to hear when you call. Then you're on a line of 15, 20 people, and you have to wait to get information. But we had to really just be in person. I'm seeing here Cheryl is saying now that personal intervention and the willingness to learn. There's a lot of stuff you got to learn, and you got to learn quickly, because your individuals need help now. And so the learning curve is steep and quickly, because you got to do it now, so you can't wait. Yeah.
That's another thing about being a part of a community, because now with your learned experience, I've seen you walk with other people as their parents were aging, and you can immediately point them to, hey, this is what we've done to help in this situation, so go ahead and try this. I saw you pick up your mic.
Yes, thank you. And then also, as Pastor said, it does take time. So you have to actually have the time to wait on hold. The comment was made early on, oh, well, I can just make a quick phone call for you. And I'm like, there are no quick phone calls. Like, nothing is quick. Everything takes time because you are on hold, and then you have to wait for the person to call you back. You have to be able to be available to take that phone call when the person calls back. And then I also still work full time. So that's just another challenge, to have to navigate my own life, my own business, my own full-time job, and now caregiving has become full-time as well.
So that opens up another avenue that you may have experienced, and let's talk about that a bit. What do we say to the people that are caregivers? And so the elderly, they need care, and oftentimes they can't do it for themselves. So how do we help that caregiver? What do we say to them? I don't know who I'm talking to, but I guess somebody got some experience.
I would like to just point out at this juncture in the conversation that there's medical resources. You can consult with a physician in your medical team. It might be your pharmacist even, or unfortunately it might be a first responder that's coming to your house because of a 911 call. And we also have all of these resources, right? But I find in my own work that oftentimes we've missed a lot of opportunities for families to talk to one another. So Dr. Moore, you said, one of 8 siblings. There's a lot of bad things that can happen if those 8 siblings don't get on the same page about what's happening with mom or dad. And even if you have the medical care and you have the resources and you know how to navigate them, if people's expectations aren't in line with one another, you can add more to the chaos and sometimes the crisis that's already happening. So as we move into the Thanksgiving and Christmas holiday. I know it might sound a little morbid and uncomfortable sometimes, but I think it's a great time for families to have those conversations. What do we do if we have to call 911 and mom or dad is unresponsive? Or what do we do if the physician tells us this is a disease that we can't well control and there's going to be decline and deterioration? So those are very real things that nobody really enjoys having those conversations, but I've seen it over and over again that when people have had those conversations and know the wishes of their loved one that they're caring for, it can be a gift to the caregiver because they don't have to question, what do I do now? And how do I do it? And what would mom want or what would dad want? Because they know. And I think that gives some ease to the person who's being cared for as well.
I think more and more the medical community is realizing the importance of caregivers and the burden and joy that comes from caring for a loved one and how difficult it is. And I think supporting caregivers is an important part of a physician or other medical person's job in terms of taking care of the patient. So you're not just dealing with the patient, you're also dealing with the caregivers, because if they get burned out, then you have real problems. And so that's an important thing to look out for.
So now, Dr. Elwood, give us some wisdom. Dr. Bronner brought it up. If you've had a physician for a while, we do know there's a turnover happening right now with physician care. And so a person is accustomed to one, that person knows their history. Now you've got a new physician. Like, kind of what's that like? What's your experience with elderly?
Yeah, so I think one of the biggest things is advocating for yourself and for your health. And what that might look like is you're meeting a new physician and you're asking them questions as well, right? They've got a whole list on there. I'll tell you, on the computer screen, you're checking boxes and sometimes going through, and then you don't realize there's a person in front of you. And to be curious about their life experiences and what they really need in that moment. And sometimes it means stopping whoever's talking to you, if that is your new physician, and saying, you know what, this is really bothering me right now. I have this particular issue that I've now developed, and I'm concerned about it. And remembering to use those phrases can kind of, as a physician, lend me to say, oh, wait, I need to stop, I need to pause, I need to be curious about this, and I need to ask more. So as you're walking into a new environment, a new office, a new person in front of you, really advocating for what you need in that moment, and then also being curious, as we were kind of talking about caregiver support. I can provide resources, but if I'm not asking what you need and what your life looks like, I'm probably not providing you with anything that's going to be useful. I think actually asking the question, you're working full time, that sounds really challenging. What do you need? What do you need from us? Is it medication support? Can I provide you a packet so that we can just say AM, PM, that's it, and make it as simple as possible. But I don't know those things unless I ask that question.
And now, Cheryl, you probably have experienced this, and others also, when actually someone needs to go with that person to ask those questions because that person don't know to ask them at this point. Is that right?
Yes, and something that you said, which really struck home with me, is even the doctor asking, what do you need? We were in this probably a good year, and at a doctor's appointment with my mom, and the doctor finally said, well, have you been working with our social worker? And I said to her, I didn't know you had a social worker, because I didn't know to ask, and she hadn't asked us either. And also, as you were saying, like the doctor, sometimes you're just going through, it's just your checkup. And I'm always in there asking a bunch of questions. And so the last appointment we actually had, she said, well, this is only for this specific thing and not that. And I finally told her, we've been at this for a while. You already know what we do when we come in here, so you need to schedule 2 slots anyway, when we come in, because you do have to have someone to go with you to advocate who's going to ask the questions. A lot of it, like Pastor said, I kind of have had to learn the system, and now I'm meeting people, and now I'm talking with people, so I kind of did it backwards, which is very stressful. So hopefully this forum does allow people to be able to find the resources that they need on the front end as well. But if more doctors actually ask, what do you need, that would be very helpful.
Or either, what I'm hearing though, is sharing what you know. Because if you're dealing with an elderly person, there's a social worker who work with you. Is that right? Social workers are available. Is that right?
Yes, yeah.
And so it would stand to reason, why would I have to ask that if I don't know how to ask that?
Yeah.
That's another system thing that bothers me.
Yeah, social workers are a funny thing in clinics, because the way Medicare and insurance is set up, often the social workers are not sort of able to sort of generate money for the clinic. And so there are a lot of clinics that don't even have social workers because they just can't afford to, they feel like they can't afford it. But I think it's really incumbent, if you're taking care of a lot of older people, to have a social worker on staff. I think that's, and besides social workers, there are other, non-physician healthcare workers that are really important for older people to have access to, So social workers are essential, but pharmacists become real important as well, because of, as I mentioned, the polypharmacy. I've worked in clinics where I had physical therapy and occupational therapy available right there, so we could really figure out things while the person was there, so they didn't have to make several trips. But a multidisciplinary approach is really important in taking care of older patients, but it's unfortunate that a lot of clinics don't have those resources.
Just before you we're about halfway through. We're back on all of our platforms now. And so jump back on, share with someone, share right now, because this is a very rich conversation we're having tonight. We really want to get this information out in our community. Once again, if you're caring for an elderly person, if you know somebody that's caring for an elderly person, if you got a parent, a grandparent, you've got someone that's aging that has any type of problems and issues, we've got individuals here that's providing resources and answers tonight and real life experiences. So go ahead and share, and let's get individuals on, because definitely want to get this deep into our community. Okay, go ahead, Cheryl.
I was just going to also encourage anyone who is an advocate, something that you said, don't be afraid, which I already said, to ask the questions. A lot of the people who I ended up finding out that there was a social worker, there was a pharmacist who helped me do a medicine reconciliation. I didn't even know that that was something that was available. But I kept asking, if something happened, I would say, well, there has to be a way that we can do this. There has to be a way that we can figure this out. So because I kept saying there has to be a way, then that's when the answers started, some of the answers started to come as well.
I think that, oh, go ahead.
I did want to mention that here in Kalamazoo County, we do have the senior millage, and we are doing several things for caregivers, and we do really care about caregivers, and we have programs that we are doing. We just had our 2nd annual Caregiver Day. It was in September, and we had anyone who was caring for someone over the age of 60 that wanted to come and be pampered for a day, and that turned out really well. Heather was a volunteer, and we just really want to know that caregivers do have resources. And I facilitate a support group, and I know Heather does as well. And we have a couple more projects coming out soon. So if you're computer savvy, you can look at our website. If not, you can call. But, there's lots of new programs coming through our senior millage.
I have a question take a slightly different approach here. What can you put in place prior to needing elderly care? And I'll ask this question with this backdrop. Watching my father do what he did with his father and mother, and watching my mom with her dad. And, well, I was 6 when my grandma died. But watching them go through that, they start putting stuff in place. So what can we put in place now to help when we do need care?
One of the first things is advanced directives, and that's sometimes a word that gets thrown around in clinical settings, like, do you have advanced directives? And that are those, if we think about those words, it can be kind of enlightening as to what that means. And that means that in advance of your death, the end of life, in terms of chronic conditions or medical conditions that you might encounter in the future, that you have given direction. You have directed your loved ones and your medical team or the life EMS or emergency medical responders in the case of an emergency or your incapacitation, that there is clear directions on what you want. And those are kind of, we think of emergent situations, and surely we want those to be in place. So going back to some of those conversations, right, of just informal conversations like, you know, Mom, you're getting a little older. You've mentioned that you've noticed some changes. Let's imagine 5 years from now that you maybe need some help. What does that look like? What do you want your life to look like 5 years from now? And then you can start bringing in some of the practical questions like, okay, what are the resources to make sure that we can have that happen? Can you live in your own home until you're 95? What might we need to be able to advocate for you and to enable you to be able to live the life that you want to live until you're not able to do that anymore? And sometimes that means having a social worker or a chaplain or your faith leader or a good friend or a trusted individual that can either be with you in those conversations or help lead those conversations. And have a trusted individual that can do that to really think about what do I want for myself and my family, and how are we going to do that together as we walk through the end of life?
So let's push that, because I think that's a very strong point that each of us should do. And because if you're living and continue to live, you're going to get older. And the longer you live, the older you get.
That's a truism. Yeah.
And that's the more chance that something is going to happen. So I like that, and really hear that advanced directive. We need to put directions in. What do you want to happen? What resources are available? When going through that with our mom, I came back. I got long-term health insurance, advanced directive. So all that is done, navigating and seeing some of the hurdles we had to jump over with them. Then it calls us to come back and really put some things in place. And so, and I think that's a word for all those that are watching tonight. Make sure you've got some things in place for when something happens in your life, because that helps tremendously.
Yeah,
Right,
I'd
Cheryl?
just like to raise the point that as far as advanced directives are concerned, I think the real key, the essential part of advanced directive is to pick somebody who you trust to advocate for you when you're no longer able to make decisions for yourself. Yeah. And I think that's sort of the essential notion of an advanced directive, because it's very difficult to know what's going to happen in the future and what kind of decisions you're going to need to make. Mm-hmm. But having a person who you choose so that other people don't get to make those decisions, that, you know, somebody who you trust to really look out for you, and having that person and having them be an advocate, I think, is essential. And I think that's a way also of preparing for the future too, is to have somebody who you really trust who goes with you to the doctor's office, even if you're totally together. Because I think having somebody else there is really helpful. As Dr. Elwood said, having an advocate with you, because a lot of times doctors have their own agenda. You know, the electronic medical record, as everybody knows, doctors' faces are in the computer, and they're just checking the boxes trying to get through the visit. And I think disrupting that is essential if you're going to get good care.
I'd like to just add to that, to not only identify the person Like, identify your person and then tell them. Because again, I've seen many, I'm the oldest child, so I think that I'm the one that's going to have advanced directives or know what the plan is. And then, my sister who lives 6 hours away or 5 states away is the one that mom said, you're my power of attorney, you're my guardian, you're my person. And then you have to deal with that. So, having those conversations and making that known and revisiting it. If you did it today or over Thanksgiving and 5 years from now, a year from now, revisit that and make those changes.
Had a question come up, and I'll just read it verbatim. I heard the concept of polypharmacy mentioned. If you feel those you care for are experiencing that, how do you correct that or find out if that's true or not? End question.
Well, I think one way to do that is to bring it up at the doctor's office. I mean, a lot of doctors assume that you're happy with taking all the drugs you're taking, and I think that's an assumption for a lot of physicians. And so I think bringing up the issue that, hey, maybe I'm on too many drugs, and what drugs are actually helping me now, and which drugs may be actually hurting me, is I think a really fair question to bring up at a doctor's visit or nurse practitioner or physician assistant.
It's also a good idea, I'm sorry I cut you off. It's also a good idea to keep a record of what medications that you're taking and how much, at least at a bare minimum. I know people who've taken pictures of them. So if you find yourself in the doctor's office and the doctor's asking, well, how much of that were you taking? Or you have that readily available, but you also have it in case you're in the hospital or you have an emergency, you can quickly provide that information.
Yeah, I was going to say, also, sometimes we're taking medications for the side effects of other medications that maybe we don't need. So I'm taking a medication because I'm getting a side effect from it. But as we age, sometimes those medications are trying to prevent events that are likely maybe not to happen as often or aren't providing as much benefit. And so we can potentially eliminate those medications. And if we do that, then we eliminate potentially another one that was helping with the side effect or some of the effects of another medication. So it's really important to always ask. I think a lot of the time nursing staff at physician's office or at offices, primary care offices, will ask all the medications, but also asking the physician or that nurse practitioner or PA the question too, are there any medications I don't need to take? Because sometimes you'll end up with potentially 15 after a hospitalization, and it's overwhelming. And some of those are because we have an algorithm, and there's this decision made without really consulting the person and what they really want and the quality they want. So.
Yeah, it's much easier to prescribe a medicine than it is to stop it, because you really have to know what's going on in order to stop a medicine, whereas starting one, it's a much simpler task. So it really requires the caregiver is to really know that person and what each and every one of their medicines is doing. And Dr. Elwood brings up the notion of the prescribing cascade, where you're on medicines to fight the side effects of other medicines, whereas you just stop.
Yeah.
Sometimes you just stop the medicine, you can get rid of 2 of them then.
I think a great question always is asked as well is, what can I do in lieu of taking this? Because I remember doing that, and I was being prescribed another medicine. I said, okay, so I don't want to take any more medicine, so what can I do in lieu of taking this? So, well, you can watch your diet, and don't eat this and don't eat that, and exercise. That's what I think I want to do that.
Yeah.
But since we're on medicine, let's talk about that a little bit, especially the cost of medicine for the elderly. Huge problem. And maybe we should have pharmacists here, I don't know. But can we talk about what can we do with the elderly with the high cost of medicine that they have to take, and it's taking a chunk of their income just trying to survive to buy the medicines? Can we, I don't know who addressed that, but.
Well, I just wanted to say that it's open enrollment right now until December 7th. So if anyone wants to call the MAP program, MAP stands for Medicare Medicaid Assistance Program. So if they want to change their Medicare or their Medicare drug plan, they can call the MAP program and they can plug in their medications and they can see if they're on the right plan, because sometimes they can save them a lot of money. And there's a lot of trained volunteers that know what they're doing, and they can tell you if you're on the right plan.
Can you say that one more time, because that's information that we need to get out?
The MAP program?
Yeah.
Okay, MAP programs, MMAP, stands for Medicare Medicaid Assistance Programs. So if you have any questions about Medicare, call them. And the regional coordinator works at the health department on Elcott Street, where the Area Agency on Aging works there. And she has trained volunteers that come in and will meet with a person and go over all their medications to see if they're on the right plan.
Okay.
So it's really nice. It's a free program.
Thank you so much for that information.
Yeah.
I will be in touch with them this week.
Yep.
So one of the other things, like Pastor, you were asking with the cost, there have been times where I've gone to pick up medication for my mom and they say the price and I'm like, we're not paying that. What else do you have? So we've had to use like GoodRx to go through that as well to reduce the cost, and they'll run it through and it does bring it down some, but that's good to know also as far as the plan. And then also speaking to the medicine list, as far as all of the different medications, I do have a list now after having gone through this process. Doctors love to see me now. So I'm just like, which list do you want, the short list or the long list, or when the paramedics have to come? Because you do have to know, and I have a whole big grid. You kind of get a little anal sometime, you know that already. I have a whole grid, like what is the medication, when did they start it, what is the dose, how do they take it, how many milligrams, you know, all of that. So for anyone, whoever asked that, who's like an advocate, if you're going to the doctor with someone, just having it all written down, in addition, if they ask for you to bring the bottles or take the pictures of it, does help, especially when you're in a, if the paramedics have to come too, and they're like, well, what are your medications? So you don't have to spend time going through, you can just pull out that list and give it to them as well.
Do we have access to that phone number? Do you have that phone number for the MAP program?
I can look it up and then give it at the
Okay.
end.
And they're advertising it all over, right?
Yes.
Okay.
Yeah. Yeah.
Another follow-up question is, it just got retracted, but here's what it was. Does the social worker cover all financial situations? And does that number, the area agency on aging, help with folks in all financial situations?
Yes. So the program that goes into the homes that I was referring to, it's for anyone over the age of 60, and there's no income limit for that program.
Sweet. Thank you.
Okay, can we, let's talk about, I want to make sure we hit as much as elder abuse. Let's talk about that a little bit. That happens a lot with elderly abuse by individuals taking care of them or others. You talk about that. How do we navigate it? How do we deal with that?
Yeah, I think that caregivers need to have a high level of suspicion for that, physicians, and that's something that we're on the alert for, because elder mistreatment is fairly common. Like, it's estimated like 5 to 20% of older people have some sort of mistreatment. And the mistreatment can be physical, which is, you know, more obvious sometimes, but it also can be emotional, it can be economic, it could be psychological. So we really need to look out to find out about that. And that sometimes involves talking to the older person by themselves, you know, without anybody else around who might be threatening them. And it's mandatory reporting in the state of Michigan, so for elder abuse, to the Department on Aging. So it's an important
And we
thing.
figured, we found out that that's why the families, if in a way possible, really need to be intricately involved. And you need to show up a lot, and you need to show up at different times, and you need to show up unannounced. And then that way, we found that they get better care
Yeah.
if the family is around. If not, you're sitting in the corner by yourself, and particularly if someone else is taking care of them. And so that's just a word to families that you need to be there.
Right. I mean, unfortunately, a lot of elder abuse and mistreatment is perpetrated by relatives, children, getting back sometimes, because they may have had problematic relationships with their parents, when they were younger. So it's something to be on the alert for.
And the next one is elder fraud, when individuals are taking advantage of elder, taking their money, the calls and all that.
Yeah, financial abuse, yeah.
Yeah.
Yeah, and that's happening a lot, because, people get tons of mail about, so-called, winnings things and lots of phone calls, and they're really unscrupulous, so those really need to be screened,
Yeah, I mean, don't respond to anybody that call you, you call them. That-
And when my mom was in for the 2 weeks last year for the facility for the rehabilitation, that is one of the things. We were there every day, all day. They were probably happy when she got discharged because they were tired of seeing us as well. But then I would see other people who were there and no one was there from,
Right.
no loved ones. And sometimes people would need things and they're yelling down the hallway for help. We were there all the time, so I was always going down the hall, Mr. Such and Such needs help over here. Have you heard him? So those are things as well. If someone does have someone in like a facility, making sure you are checking on them, going up regularly, like Pastor said, going up unannounced, so that they don't know that they can't put in a time frame. Oh, she's going to be here at 3 o'clock, so we need to make sure that mom is taken care of. So it gives the appearance of that. And then we did notice that my mom was taken better care of. When we were there. And then now she does have people coming into the home, so we make sure that someone is there when they're there as well. And then I always make sure I meet everyone at least the first time when they're coming into the home. And then I usually make sure I make the comment on the way out, yeah, we have cameras all over the place too. So, have a good session.
So it's always important to be an advocate, even if they're in a long-term care facility. Always, always important. We have 2 long-term ombudsmen that cover 8 counties. And they are advocates for those people that don't have anyone. And they are wonderful. And so if you know of anyone, or if you have any problems in any licensed facility, whether it's an assisted living, an adult foster care home, or a nursing home, you can call them and they will be right out there helping you being an advocate for your person.
Okay.
I do have that number.
Say that again. I need everybody to get that clearly, what you just said.
Okay.
You got 2, say that, yeah.
Okay, so it's very, very important to be an advocate no matter where your person is. Don't assume they're being taken care of because they're in a facility. And I said, we have 2 long-term care ombudsmen, and they cover 8 counties. And their sole job is to be an advocate for for anyone in a licensed facility, whether it's a nursing home, an assisted living, or an adult foster care home. And so if you ever have anybody that needs help, call them and they will be out there the next day to help you with an incident. And they are wonderful. And I do have that phone number for MAP. That phone number is 1-800-803-7174. And you can meet with a volunteer or you can do it over the phone. And again, they're trained, they know what they're doing, and you will get the help that you need.
Thank you.
Just signs, we're getting close to our ending time, signs that we should look for with aging individuals that let us know that something is happening that we need to really pay closer attention to. Can you give us some signs?
Yeah, sure. I think one of the things I watch closely is weight. So weight loss is often a sign that something is going wrong. Either the person's forgetting to eat or they have some illness that's keeping them from eating. So weight is a really important thing to follow. You know, just how they look, you know, just their functional ability. Are they dressing themselves, you know, are they well kempt, things like that. You know, sometimes one of the early signs that people notice with people who have cognitive impairment is that they start repeating things, repeating questions over and over again. And that's one of the tip-offs that something's not right.
Question, one more question as we get close to wrapping up. For those who are supporting in the community, those who are supporting and caring for people, I know sometimes we can say ignorant things, not knowing the experience. Are there any things that just are not good to do, to say to a person who's caring for somebody, things that people do that we can expose and say, you know what, and bring some awareness, that's probably not the best thing to do, or here's something better you can do as it relates to somebody who's caring for somebody else, just so we as a community can be better at that?
Well, I would flip that question around and say, what can we say? And I think those things are the affirmative relationship things that tend to dwindle. Helping people feel connected and loved. So just even telling people that you love them or expressing however you express your affection and care for someone as they face different challenges, and letting them know that they're cared for and that there's genuine interest. And that might be, you know, you don't talk to your mom who lives 6 hours away except for once a month. So maybe you call once a week or you send an extra card. And those things seem very small and maybe even insignificant, but for someone who's aging alone or facing difficult circumstances with their health, it can really make a difference.
Yeah, and one of the things to not do, I think, is to not take people's complaints seriously. And I think that's been a problem with a lot of complaints of older people. Doctors will say, well, what do you expect? You're old, you know? And sometimes that explains what's going on, but a lot of times it doesn't. And so I think when you hear something like that, well, what you're experiencing is just your age. Sometimes there actually are problems that you can do something about. And so I think that can be something that I would really discourage people from saying.
Okay, we got about 2.5 minutes, and we'll take 3. Just last comments that you need to share with this audience that we haven't covered so far. We'll start here.
I would just say, again, be an advocate for your person and reach out to get the help that you need. And again, like Heather said, have those conversations and let your person know that you care and treat people with dignity and respect. Just because someone's an older adult doesn't mean that they're less than. And I think that's what happens in our society. And it's not okay because they are wonderful, wonderful people.
That's ageism, right?
Ageism, it's not okay.
That's what I intended to talk about. But go ahead.
I will just second what Patty says, and I would encourage people to reach out to the Area Agency on Aging wherever they are, and to stay connected with the resources that they know and trust, and to try and learn about others.
I would say to everyone who is a caretaker of someone else, caregiver, make sure you're taking care of yourself as well. Because that oftentimes one of the things you said, sometimes the caregiver goes down before the person that they're taking care of. So make sure you're doing self-care. It's easier said than done. Living witness to that. And then also don't be embarrassed to talk about what's going on with other people. The reason why I have been able to get resources into the home for my mom or outside of the home, a lot of the things that have happened up to this point is because I talk to everybody about it. And then through conversations, you find out about other agencies, other resources. You get clarification on things that you can take advantage of. So because you don't know what you don't know, so by talking to other people, you find out information.
I'll mention something about prevention. So thinking about as we're getting older, trying to make sure that we are maybe up to date with vaccinations to prevent illness, taking a look at the home, talking about those difficult conversations of what would happen and how do I want my life to look as I get older would be just something I would really encourage everyone to do.
Yeah, I think bringing up questions to your doctor, and if you feel like if they're not being addressed, to ask them again and make sure that your questions are answered and that you really feel like somebody is taking care of you when you go to see a doctor. And if that's not happening, then I think there are lots of people out there who can do that.
Wonderful. Thank you so much for joining us tonight. And we are enriched because of what we've experienced, and not only us, but the lives of others as well. Thank you for your questions. Thank you for tuning in. The beautiful thing about our conversation tonight is that it will still be on our platform, so you can still share this and even have conversations with those in your families around what we've learned tonight. So thank you so much for making this experience what it was. Let us pray. Father, we thank you for allowing us to gather. And we thank you for what we've heard tonight so that we can take care of those who cannot always take care of themselves. Thank you for putting us in a position to receive this information tonight. In Jesus' name, amen. Thank you for tuning in. We love you.